Hi, my name is Jasmine Pope. I am doing week 5's video for chest tube assessment for Professor Gano's class. First things first, I would knock on the door, introduce myself, and what I'm going to do, which is assess the chest tube drainage system and the chest tube insertion site. I would perform hand hygiene, have the patient state their name and date of birth. I would then do a respiratory assessment. So I would listen to the lung sounds surrounding the chest tube, and I would ask about any type of pain they may be experiencing or if they're having any signs and symptoms of respiratory distress. If everything's okay, I would then continue to proceed, making sure that the chest rise and fall are normal and even. I would make sure there's no tracheal deviation. I would then lift up the shirt and I would assess the chest tube insertion site, ruling out any signs and symptoms of infection. I would make sure that the dressing in place is clean, dry, and intact. And if it is soiled, I would make sure to note the color, how soiled it is, if there's any type of abnormal issues. From there, I would make sure that the chest tube is connected to the system. I would check the drainage tubing, making sure that there are no issues, no loops. If there are clots, I would make sure to milk them out. We have to keep in mind that there are wet or dry chest tube systems. So determining the tubing system, we then assess the suction settings, making sure that it matches the order. I would check the water seal. If it's bubbling, that could be an indicator of a leak or a pneumothorax, and sometimes patients will have pneumothoraxes after a very traumatic event, and you just want to make sure that the pneumothorax is getting better and it's going away and it's not new. From there, you want to make sure that the tube never comes out, and if it does, you want to apply Vaseline gauze immediately and call for help. You want to make sure that the drainage in the chest tube system, you want to check the output, you want to check the color, you want to check if the color is appropriate for the recovering phase that they're in. From there, we want to make sure that the dressing is time dated and it's documented correctly. Before leaving the room, you want to make sure that the patient is stable. You want to make sure that everything about that system is definitely in place. You want to make sure you're noting their pain, the respiratory assessment, the drainage, eyes and nose, ruling out air leaks, and just making sure that you're documenting appropriately according to whether it's a wet or dry system. And that's how I would perform a chest tube assessment.